Ladies and gentlemen, dear ministers, WHO colleagues and valued partners, I am delighted to be here today and present Armenia's experience of work toward ending HIV, TB and hepatitis. I will begin with the HIV, where Armenia registered the most remarkable achievement because of mobilization of multi-sectoral efforts. Before 2001, the national AIDS response in Armenia was not structured or systemized. Only separate activities were carried out with almost no intersectoral and multi-sectoral coordination in place. We realized that cross-sectoral collaboration in justice, education, finance, social protection and other sectors must be key to give access to all services and commodities people need for HIV prevention, treatment, care, and to enable people to know how to protect themselves from HIV and avoid transmitting the virus. The laws violating human rights and imposing major public health threats for populations, such as travel restrictions for people living with HIV or mandatory HIV testing, were amended to avoid deeper stigmatization and discrimination thereof. Along with the described legislative changes, Armenia approved unprecedented growth of budget allocations for reproductive health services and child health to ensure the affordability and accessibility of free obstetric and pediatric care services for children and women of all social groups. The training programs have strengthened the human resource capacity in HIV counseling and testing, patient management, and lab diagnostics. The healthy life subject was introduced in school to increase the awareness of HIV issues. And finally, the key to success in this undertaking was the remarkable collaboration between the National AIDS Center and maternal and child health services countrywide under the leadership of Ministry of Health. All those considerable efforts have brought to the establishment of effective PMTCT model, thanks to which the country achieved the elimination of mother-to-child HIV transmission. The similar intersectoral collaboration in TB sector also ensured to nearly halve the number of new TB patients and decrease the mortality by more than 3 times. Current public health policy in Armenia in HIV and TB is targeted at strengthening of primary healthcare services, which is key to achieve our targets. Moving forward, our intention is to use the system and experience gained in effective HIV response as an entry point for tackling other co-infections and infectious diseases such as hepatitis, if possible. Viral hepatitis is another most important public health priority in Armenia. While there are implemented and sustained policies in the hepatitis B response field, the hepatitis C was left behind. We intend to implement the first assessment of burden of hepatitis C in Armenia with WHO support and develop national strategic plan of hepatitis control. At the same time, efforts have already been undertaken by the Ministry of Health to ensure the accessibility and supply of DAA in Armenia through in-country registration of medicine and mobilization of donor and state budget funding. Dear colleagues, let me quote Nelson Mandela. We can't fight AIDS unless we do much more to fight TB as well. And let me add from my side that we need to do much more for hepatitis too. Thank you.
Thank you very much, Excellency. We move to Czech.